You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. All right, folks, the numbers in major cities are eye-opening. In Chicago, as of Saturday, 70% of the recorded deaths were African-American. In Detroit, as of Friday, African-Americans made up 35% of cases and 40% of those deaths. And in Philadelphia, 46% of COVID-19 patients were black. To understand just how this is going, folks, these health disparities are real. And is Dr. Georges C. Benjamin, Executive Director for the American Public Health Association. Dr. Benjamin, glad to have you back at Roland Martin Unfiltered.
Roland, good to see you.
So this really should be a wake-up call. It should be, frankly, an opportunity for mainstream media to apologize to black folks for pretty much ignoring these issues. Like I have been saying, the coronavirus has exposed America. It has laid bare this nation as to exactly how it is treating its citizens. And so what we're seeing are people who now are having to confront what actually has happened with this healthcare system. Dr. Fauci yesterday, again, spoke from the podium. All of a sudden, all these media outlets are doing stories about it. Hold tight 1 second. Looks like Dr. Burks is now actually speaking live. We just want to go hear what she has to say live, so go right to the news conference.
In Spain, and we are doing much better in many cases than several other countries, and we're trying to understand that. We believe that our healthcare delivery system in the United States is quite extraordinary. I know many of you are watching the Act Now model and the IHME model and they have consistently decreased the mortality from over almost 90,000 or 86,000 down to 81,000 and now down to 61,000. That is modeled on what America is doing. That's what's happening. And I think what has been so remarkable, I think, to those of us who have been in the science fields for so long is how important behavioral change is, and how amazing Americans are in adapting to and following through on these behavioral changes. And that's what's changing the rate of new cases, and that's what will change the mortality going forward, because now we're into the time period of full mitigation that should be reflected within the coming weeks of decreasing mortality. I mean, that's what we really hope to see. We are impressed by the American people, and I think models are models. I've always worked on validating. I spent my life validating models all over the world, and that's why we do surveys and surveillance, and we make sure that what we think is right is right. I think this will change how people look at respiratory diseases, because it will change what is possible when the globe, and particularly the American people, do this level of mitigation. And I think, as I talked about yesterday, we are still in awe, really, of the American people's strength in this and following through.
If I could just ask Mr. President. Yeah, I'm going to do that. I'm going to ask Bob to come up just for a second.
Come on. All right. So, Dr. Benjamin, I don't take Donald Trump live because he lies too much. So this one going back to you. And again, these people are finally waking up and realizing what the hell's going on.
Well, you know, Roland, let me remind everyone that in 1865, the Freedmen's Bureau was established to deal with former slaves and people of color. In those years, they understood that we had health disparities. So this is not a secret. The Congress of the United States actually passed legislation to create a bureau to try to adjust with these issues, not only with health, but a whole range of societal issues as well. Now, as you know, they took that apart. And so we've been dealing with that since, obviously before then, but 1865, Frederick Douglass argued for it. W.E.B. Du Bois studied it. So we understand these disparities exist, and none of us are surprised when this happened. In fact, you remember when I was on your show, myself and the other colleague that you had, other physician you had on the show, talked about these disparities and the risk to communities of color.
And again, well, what is interesting here is that you're talking about the underlying, and this is the thing. I think when you talk about that, I think when we talk about all of a sudden people realizing, oh my goodness, what, 40% of these kids in a lot of these areas don't have access to the internet, okay? And so we can use the word underlying for a whole lot of stuff that coronavirus is now revealing. This right here is a moment where this White House, this Congress, and this federal apparatus needs to say, all right, you're dealing with a pandemic. You're showing who the most vulnerable. Yeah. We better figure out how to deal with the underlying when we're not dealing with the pandemic.
Oh, absolutely. Dr. Fauci talked about the HIV/AIDS epidemic, and I've worked with him during those times. And I got to tell you, what did we do? We got out into the churches. We talked on radio. We made sure the messages got out to the community about what the HIV/AIDS epidemic was. You know, we didn't really do that as effectively to the communities of color this time. We needed to do that, but we didn't. And so we now need to continue to double up and do that. In addition, you're right. When this is all done, we're going to have to make sure we deal with the societal issues. And I've been arguing for a new social compact for our society so that we can deal with the underserved. We can deal with the folks that have been just left out in our society. And in many places, of course, that includes communities of color.
And I think that for the people out there, when we talk about, you know, what this is revealing, it also begins to reveal itself in terms of, obviously, actions, in terms of how serious we take it, but also resources still come to bear on that. When you talked about the response when it came to HIV/AIDS, the reality is you still had people who were fighting the shifting of resources away from white gay men to African Americans. And in fact, I remember there was a sister, she was in HHS under President George W. Bush, Pat. And well, I can't remember Pat's last name right now, I'm sorry. But she talked about that, and she was targeted by a lot of these white gay men organizations. And so she went to LA and she said, y'all want to meet? Let's meet. She said, the money should go where the need is. And when that need began to switch from white gay men to heterosexual black women, and then gay black men, people, oh my goodness, you know, what are you doing? Yeah. And that's always been the case. I remember when I was in Chicago, same thing. Loads of HIV/AIDS money going to the north side of Chicago, but ignoring the south side of Chicago. And so this is also where black interest groups have to be even more vigorous when it comes to fighting because, you know, again, we are seeing numerous folks. We are seeing African Americans in so many these different cities dying. Latinos are slightly ahead of African Americans in New York City, but the people who are dying in New York City are black and brown.
Yeah, that's right. And, you know, we don't understand all the reasons. You know, we said that if you get this, people who had chronic diseases would do worse. But, you know, we hadn't thought a lot about, which we, you know, I think all of us failed to do this, quite frankly, the number of people of color who are public facing. So when we tell folks that they got to stay in their homes, and then we say there are essential businesses, those essential businesses fall on us.
Right.
Bus drivers, grocery clerks, all those kinds of folks are out here every day, and they're at extraordinary risk.
And what you're not seeing again, and again, essential businesses. But then you have let's just go there. You got Republicans who fight paying $15 an hour, who fight a fair wage. But it's like, oh my God, right now, if it's not for those people stocking grocery shelves, if it's not for those people on the front lines when it comes medical workers, if it's not for people who are on the front line, I mean, it's a whole bunch of so-called essential services that we are not having access to if those people were not there. And so this whole thing should cause, I believe, a dramatic shift in thinking in terms of how we approach essential workers, because as you say, for African Americans, the black and brown folks, they're the ones who are working in public transportation. They're the ones who are working in restaurants, these customer service jobs, and we cannot deny that reality.
I thank them every day I see them when I have to go out and do some essential work in an essential business. I thank them for being there. And, you know, when this is all done, we're going to have an enormous discussion about a living wage. We're going to have another continued discussion about paid sick leave. We're going to have to talk about income inequality. And for me, we're going to absolutely have to talk about having a system with everyone in and nobody out, so that everybody has quality, affordable health care and access to health insurance.
I do want you to speak to this here. There was a gentleman who was arrested in Cincinnati because he did a video where he and others were out celebrating. They said they didn't get damn by coronavirus. And unfortunately, when you see this video, it's a whole bunch of black people. If y'all got it, roll it.
Yeah, that's how we doing it in my city, man. We don't give a fuck about the coronavirus. It's how we celebrate our coronavirus, bitch. You got 1,400 people watching you right now. What you got? Yeah, man. We here with it. I know what the fuck going on, man. I'm 14. I'm talking about 1,400. It's viral right now. Allah Akbar. I know what the fuck going on. I told you I'm pulling my ass.
Dr. Benjamin, here's a guy. I mean, you see those black folks out there. He says we don't care about coronavirus. Young black folks. I still believe one of the mistakes that was made early on with this whole notion that if you were young, you can't get it. And so that gave a whole bunch of folks license. And then all of a sudden we start seeing 20 and 30-year-old people dying because of coronavirus. But this is where black folks have got to be yelling from the rooftops. I don't care what sector of black America you're in. Stay the hell at home.
I think the message is that we're not immune. And yeah, we always talked about older Americans and sicker Americans getting sicker. But I think we always had that caveat that if you were young, you could still get it. Now, we didn't think you could get this sick and die. There was not that a lot of evidence, but, you know, that was in a different culture, in a different country. And the fact of the matter is, when you see stuff like that, because we see that on the internet all the time, middle finger, bad language, stupid thoughts, people should recognize them for what they are. Now, when they get sick, we're going to take care of them. Unfortunately, you know, they will maybe very well get sick if they're out there and they get exposed. And of course, we're going to take care of them. But I got to tell you, this is stupid. And nobody should be taking this attitude and running with it. Well,
and again, he's touting 1,500 people who are on his Instagram Live. And I'm sitting there going, yeah, but those 1,500 could very well be talking about your death.
That's right. That's right. And when he gets sick, ain't nothing, one of them going to pay his health care bills.
Right.
You know, and I doubt that too many of them are going to say, you know, some nice things about him. And what I'm hoping is those 1,500 people don't listen to him and recognize the foolishness that he's expressing. Because I'm going to tell you, what he's expressing is foolish. You know, I am sitting in my house. My whole company is remotely working. And I remember the last time on your show, we talked about the next time I saw you, you would be remotely working, and I can see that you are.
Well, actually, I'm in the office. So what we did was we don't have any panelists.
But your guests aren't there, right?
All right. We don't have any panelists. We don't have any guests.
Yeah. That's right.
You know, the people where we co-lease with, they haven't been in the office since the end of February. We have at most 5 staffers at most. We absolutely practice safe distance in terms of being able to do work. Everything gets wiped down, Lysol'd. Folks got gloves and masks on. I mean, all sorts of stuff along those lines, because those of us in media are deemed essential workers. And because part of the thing that I have made clear to us, this is also about frankly, we got to be on the air every day, because black people are not getting the information. All of a sudden, you're seeing black experts pop up on mainstream media, but the reality is it's not happening the way it should. And we know how black folks are. We prefer it coming from one of us, and that's one of the reasons why we do what we do every single day.
Thank you. And I'm glad to be here. And I understand that there's got to be people that people trust. It's about trusted messengers.
Indeed. Dr. Benjamin, we appreciate it. Thanks a lot.
Thank you very much, Roland. Good to talk to you.
Thank you, sir. I
want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.